I'm Hamid Nassery, DMD, practicing dentist in Miami Beach for the past 22 years. A graduate of Boston University, School of Dental Medicine. I started practicing in 1992 with a brief stint as a clinical instructor in Tufts University prior to my moving down. I moved down to Florida in 1993 and joined the practice that I eventually purchased and I own today. Always been a restorative dentist. That has always been the core of my practice, and it's through that I started becoming more interested in the temporomandibular joint and the effects of bite and occlusion on my work. And over the last 10 years, I have intensely studied in those fields. I've been able to get my fellowship in International Congress of Oral Implantology, as well as Academy of General Dentistry, and in a couple of months I will have my fellowship in International College of Craniomandibular Orthopedists. Many years ago when I had just started, like many of young dentists, I was really in love with doing cosmetic work, and that's sort of creating life-changing effects in somebody's life. But soon I started to get it became normal for me, and it wasn't giving me the same. Not that it doesn't. I mean, it's just still a very nice thing to do, but doing this type of treatment, and when I take somebody from having a headache every day of their life, taking medication every day, to maybe having less than one a month, somebody that was taking heavy-duty, migraine pills like Imitrex or something, and now barely they even take a Tylenol. And they come and tell you, I can now play with my kid, I can do homework with them, I can go to work and not have a headache all day. You can't put a price on that. How it makes you feel, that just is indescribable. Especially when I had the experience myself. 10 years ago I had so much neck issues that I seriously had given thought about stopping dentistry. My work is very physically intensive, and requires for me to bend over the patients with the bent neck for hours at a time. And 10 years ago, I would wake up in the morning, I couldn't get out of bed. I had so much pain. I had electrical shocks running down my neck and my arms, weakness, stiffness of the neck, couldn't move my neck. And I thought, I'm not going to last too long. And once I started going through this type of treatment myself, which, I've been an orthotic wearer myself for the last 10 years. It's completely changed my life. I'm active. I go to the gym 4 or 5 times a week. I can lift fairly well, and I've seen the difference that it makes in life. And when I couldn't do that stuff, it was very depressing. I mean, it's not something you want to face at any age, whether advanced or young, to have inability and disabilities and lack of mobility, not be able to do things. You can't put a price on that. I think everybody understands, humans, we want to avoid pain. Think about it when you're passing by, let's say, a doorway and your hand hits it. You weren't paying attention, and the next time you pass by, whether you realize it or not, your body is going to realign itself so that it wouldn't do that again. So basically our body works with 2 sets of different things. One we call proprioception, or the ability to understand where our body is in space. We touch our nose, or we touch our hands together, but we can do it in our back also. We can take our hand back and touch our fingertips together. How do we know that? How do we do that? And that's proprioceptors, or pressure sensors in our body that immediately, once on the first touch, tells us where do we stand in reference to any object in a space. That's how we walk. And the other one is nociception. Nociception is when we hit something and it hurts, and then we know we avoid it. And we have the same responses in our mouth. So every time our teeth come together and we tap our teeth, essentially we're creating a proprioceptive response, or let's call it programming. That's how people come in with all kinds of really horrible teeth or horrible bite, and they can still bring their teeth together, because every time they touch them together, those proprioceptors, they're programming our brain and the brain telling the muscles how to bring them together so they can meet perfectly. So just because we bring our teeth together doesn't mean that the bite is perfect. No, it just means that our brain is working perfectly. The other thing is when we bite into something and we have pain, and what do? Immediately we open up and move to the other side, and we try to avoid that side. So we, effectively we change the way we function and the way we chew things. Again, that change is going to come with a price, meaning that one side is going to overwork and probably the other side is not going to work at all. One side, the muscles are going to be very loose and relaxed, and one side, the muscles are going to be hypertonic. And let's take this step further, and now we see the side that's overworking. It's going to affect the neck, and in a few days the person is going to, whether they notice or take notice or not, this is a different thing, but they're going to have perhaps a little bit more stiffness on that side. And again, the threshold and the ability to really follow these things is different from person to person, from age to person, to that, from even male to female. But that's how this would affect us. And now let's take it one more step and say we have this for years, and this effect basically starts to affect the way we hold our head. That in effect will will have an effect on how our posture is. The posture will have now we see this whole chain of effects going down from the cervical spine into thoracic, and from thoracic to lumbar, and all of a sudden the person says, oh yeah, by the way, I do have some lower back problems. I see this very common, that a lot of the cases that I start to treat, these patients, problems started from the upper cervical spine. I always know, based on cases that I've seen, the upper cervicals, to protect their blood supply, they kind of lock themselves, they stop moving. And so most of the bulk of the movement in the neck falls upon the lower cervical. So by the time they're in their mid-40s or 50s, I see a lot of degenerative disc disease in C5, C6, C7 area. And these patients have different neurologic effects in their hands, tingling, and so on and so forth. But at the same time, they have the same effect in their lumbar area, in the L4, L5, L6. There's a huge correlation. I would tell you probably better than 75% of my patients that have, or that advanced and have issues in their cervical, lower cervical area, they have the same problem in their lumbar area. And again, this philosophy and the way we treat really has to do with the whole body approach. This is the whole health approach. It's not one modality treats, it's going to fix everything. We need to work with other professionals. We need to have a patient that understands that there's no magic pill. We need their complete cooperation. They need to start to do something good for themselves, strengthen their core, strengthen their postural muscles, work on that, and then we're going to have the best, most successful cases. Research as much as you can. Ask questions. Ask, question authority. Nobody knows everything. Everybody has voids in their knowledge. And that's why it's called the practice of dentistry or practice of medicine, because there's no definitive thing. We know a lot, but we also know there's a lot that we don't know. And do your research, ask questions, and most of all, see if you trust your practitioners. See if you trust your provider. You have to you have to have trust. If you don't have that, then you should keep looking. You should continue researching. I think the most important thing is not that we're doctors or that we do certain treatments. I think it's genuinely caring about your patients. Do you really like what you do? Do you really want to make your patients better? Or is it about our ego? Is it about me being right all the time? I'm not right all the time. I can't fix everybody. I realize that, but I will sure as hell give my best and try my best. I think that's the important thing, keeping the main thing, and that's the patient.